The mission of the Fordham University Ravazzin Center on Aging is really to empower social workers and other healthcare professionals to make a difference in the lives of older adults, family members, and all generations. And what we do is we partner with many different agencies on different projects, and also working with students, faculty members, and community members to effect change.
I think one of the benefits is the diversity of the members of Ravazzin Center. The scholars who are involved are all working in varied areas of gerontology and gerontological social work, whether it's public policy, social welfare, or practice. And so what happens is you get diverse voices at the table.
As we know, the older adult population is the fastest growing segment of society. Age 85 and older are growing faster than any other part of society. So we felt that this was very important to look at the Ravazzin Center to help older people prepare as they age to talk with their physicians, their nurses, their social workers, to gather the information about how they could improve and keep quality of life in their health.
The CDA Burden Network collaboration with the Fordham Ravazzin Center on Aging is a wonderful opportunity for us to help educate our seniors about how best to communicate with their healthcare provider. We know that this is a very important aspect of overall health and wellness. I can say that the feedback we've received from our seniors has been overwhelmingly positive. They're always looking for ways to improve their overall health, but more importantly, it can help to empower them to be better advocates in taking care of their own health.
So another program we work on is palliative care, and we have the Palliative Care Fellowship at the Graduate School of Social Service, which is one of very few in the entire country. The Palliative Care Fellowship has a number of components. The heart of the fellowship is the internship that the students do, and they do this with experienced palliative social workers. They're working on inpatient palliative care teams in hospice, in oncology, long-term care, pediatrics, and then they take 2 courses, palliative social work and grief, loss, and bereavement. They meet with a career mentor throughout their fellowship year and in the year after to help them really strategize their career and to get that career going. There are a lot of patients out there who need specialty palliative services, and there's not enough trained social workers in the workforce to meet those needs. So this program is intended to contribute to that workforce.
It's important to look at is understanding outcomes. And in doing this, outcomes have to be measurable. And what we try to do in our research within the communities is helping agencies and organizations how to look at the change that they're desiring and how to see if it's really affecting change.
In my role as program director for Westchester County Department of Social Services, a federal grant called Westchester Building Futures, I spearhead along with an amazing team of researchers, direct service professionals, and community-based advocates, a grant that focuses on serving young people in foster care ages 14 to 21. Really, our purpose in the grant is to really think about ways in which we can improve outcomes for young people in care, really through the lens of youth, voice and choice, and equally importantly, family engagement. So that is, we're really working with all members of the family, from the grandparents to the younger siblings, and working with Dr. Jana Heyman, who's our principal investigator, and her leadership at the Ravazzin Center has really been a great partnership with the Westchester County Department of Social Services.
We train our coaches to help our many thousands of caregivers here in Westchester County to better care for their loved ones. The coaches are trained by healthcare professionals. So we have social workers, we have nurses, we have geriatric care managers that train our coaches.
I feel that as a caregiver, I've been given a gift. And I've been doing this for 4 to 5 years, I think. And And the clients that are the caregivers that I work with, they vary in culture, they vary in age, that I'm able to dispel some of the loneliness that 24/7 caregiving is all about.
My MSW education from Fordham University was a rich learning experience. It was enhanced by our coursework, fieldwork education, and the ability to work on a research project. It has provided the foundation for my career, and I am now pursuing doctorate studies.
What's really exciting is that I think moving forward, as we're growing and learning in very diverse ways all around the globe and also in this country, what makes me really excited is that in this country, we're going to be at the forefront of innovation and redesign.
And what's critical is that we don't just do the research, but we replicate the research, and then we see what works in practice and how not only do we take that practice, but what we learn from it, the lessons learned, and how we can affect that change, not only in the practice and the research, but in future policies and future policy decisions on a larger basis in communities, statewide, nationally, as well as internationally.